is a particular thing called public option. Let's define what a public option is.
Everybody gets out there.
All right. Here's what the bill is. First of all, the president said that if you have health insurance that you want, that you can keep it. And we have honored that in this bill that's going to come out of the committee. That means that the 47% in Florida who have their health insurance with their employer, if they are satisfied, that they can keep that. It also means that the additional 16% in Florida that have their health care through Medicare, they can keep that. It also means that the 10% that get their health care through Medicaid can keep that. That's 76% of us here in Florida. So there's 24% of us remaining, 5% of which get their health insurance through individual policies, not a group policy, through their employer. And it is often those 5% that find that they can't afford it because since there's not a lot of lives to spread that health risk over, the premiums are exorbitantly high and there's no check and balance on the insurance company. And then the remaining 20% are uninsured. And those are folks, for one reason or another, they can't get insurance, and that has been a main problem, or they choose not to have insurance. The problem here is that if they don't have insurance, they can still get their health care by going to the emergency room, but often that is after the health problem has turned into an emergency, and as a result, all the rest of the other folks that are paying through health insurance premiums are paying for those folks. In Florida, that is a hidden tax of some $1,400 a year for a family policy that you're paying for care of those who do not have health insurance. So the idea that the president has laid out is to bring all of those folks into the system in a health insurance exchange. And this is where the public option comes in. In the health insurance exchange, now we're talking about 24% of Florida. Health insurance companies would bid for that. But if they do, what's to keep them honest? And that's why you want to have a public health insurance company to compete against them. And therefore, what we have, even though the public option was defeated in the Finance Committee, the Chuck Schumer public option, which is a publicly owned health insurance company that will compete against the private insurance companies, we are working now to get the votes to be able to have that in the bill that goes to the floor so that can be a part of it to put on the desk of the president. And thus, I believe that the outline that the President has laid out to us, what he considers his absolute key to his presidency, reforming America's health insurance laws, reforming the delivery system, bringing down the cost of excessive care, and the final goal of making health insurance available and affordable to all of our people. I believe that we will pass that and give it to the President.